welcome back to the studio. And then the next interview is about to start. I'm sure all of you are aware by now that it's Valentine's Day. Even though my name is Ifunaya and means love, I'm not in that lovely spirit of Valentine. But we have a guest in the studio, and then we'll be talking about how to spread love and not HIV, because we know that there will be a lot of intimacy today, so we have to be responsible.
I don't know
and
how you know
about
that. I don't know if
we have in the studio. We have in the studio Mr. Kingsley Esemonu. He's the Chief Program Officer, Community Prevention and Social Behavior Change Communication of the National Agency for the Control of AIDS, NACA. Good morning, sir.
Good morning.
Thanks for being with us.
Happy Valentine.
Happy Valentine's Day to you. I was just asking if your red cap is Valentine inspired.
This is a chieftaincy cap.
Yes, a chieftaincy cap from.
So welcome to the studio.
Thank you so much.
Yes. So we must congratulate the government effort in trying to curb the spread of HIV/AIDS. Yeah. But among young people, especially this age, I remember that growing up there were jingles, there were billboards, our exercise books had behind it how to stop the spread of AIDS. But I'm not seeing that so rampant again. Do you think there's that much awareness now, or because we're not seeing those dire, very gory pictures of HIV patients, it has reduced?
Yeah, actually HIV is no more a death sentence. So we have given the human face to HIV, and prevention efforts are ongoing. Okay. We are trying to reduce prevalence as well as incidence. If you look at the national average now, we are beyond national average. Even with the global scene, Nigeria, we're trying a lot. Okay. And we're tilting towards the 95,
exactly.
What does that mean?
Meaning that we're expecting that by 2030, 95% of Nigerian population knows their HIV status.
Okay.
And out of these 95% who knows their HIV status and are positive, they are on treatment.
Okay.
And out of the 95% that are on treatment, they are virally suppressed.
Okay.
And when someone is virally suppressed, that is what we call U equals to U. Undetectable is untransmittable. So when the viral load is undetectable, it's no more transmissible. That's why you're not seeing, we have done much of SBCC, behavior change communication, awareness, and awareness is high. If you look at the records also, we have high level of high awareness. So what we're looking at now is maintenance of those behaviors that are preventing HIV.
You're in charge of this.
Yeah, like you said, we are on the Valentine mood. And considering also the cold weather in Abuja this morning, and I know that we are standing in the evening, a lot of things will happen. So we're expecting that young people, even the older ones, anybody who must have sexual relationship today should, first of all, know his or her HIV status.
Okay.
And if you know your status, also be able to know that you are having sex with or any intercourse with somebody who knows the status to be on the negative side.
Yeah.
And when you do that, you will be safe. And we're also promoting that you can as well use condoms.
Okay, talking about that and then talking about behavioral check, I also know that yesterday, which was 13th of February, is the International Day on Condoms. Yes, so it's good that we're marrying it today with Valentine. But I find out that one thing that is very difficult is for young women or even older women to walk into a pharmacy and then buy a condom. It's easier or more socially acceptable that a man can do that. I suppose when a woman has to take care of her sexual health and then she has to walk into a pharmacy. So in terms of behavioral change communication, what are you doing? What's your agency doing to address some kind of stereotypes like this?
Yeah, that falls within what we have in the National Condom Strategy.
Okay.
We have a national condom strategy, and apart from the national condom strategy, we have also a national condom demand creation strategy. Demand creation entails social mobilization, community awareness, and demand for uptake.
Okay.
So we want everybody to have the power to uptake services. When you uptake services means that it's your money, it's your life. If you can go to the pharmacy shop and say, I need paracetamol, why can't you say, I need condom?
Maybe
because society starts looking at
that
you
is what with the barriers we are, and we are using channels like yours to break those barriers that you have the right, you're entitled to your life. You can uptake condom at the counter and say, can I have a condom? There was a time we were doing all these studies and strategies. We decided to test run it.
Okay.
We went into a pharmacy shop and we introduced our ladies to go and buy condoms. And you know, condoms are always bought around 8 in the night and the pharmacy shop is always full.
Vibrant, yes.
So you see a young lady that will come in, excuse me, sir, do you have a condom? Everybody will turn.
Yes.
You're just looking at the
exactly.
lady. So after doing that, we'll always come back to tell the people, this is what we are doing, in as much as she has the right to use a condom, but we want people to break that barrier off. Talking about what they want. If I can go to a supermarket and say I need an ice cream, you go to a place, you say, give me shawarma. Why can't you buy your condoms? We have a condom demand creation strategy. We also have a condom strategy which talks about supplies, logistics, and standards. Okay. So we always want people to understand that there are standards. So no matter the cost of the condom, there is a standard.
Okay.
The cost doesn't determine the standard. Right. It's about packaging, and it also have a total market approach.
Yeah. Right.
The way you sew your cloth and my tailor, different tailors, different price, but the same material.
The same fabric, yes.
The same, and we wear it and we go out. So it's total market approach. Some people are bringing in condoms on their own. Government, the ones that come through government are subsidized.
Yeah,
so it's the same condom. So it's not the price that matters. It's how correctly and how consistently you're using the condom.
Okay.
You can use a condom of 1,000 naira. If you don't wear it correctly and you don't use it consistently, you're at risk.
Okay.
It's not the cost of the condom that matters.
Right.
Yeah.
Now, unconfirmed report says that teenagers rather are beginning to engage more and more openly in sexual activity. And speaking about condom, are we educating our young girls enough to demand it? Because that's another thing that has to be addressed, where young girls do not feel into the pressure of that teenage feeling. Yeah. They find themselves not demanding condoms. And another thing I would like us, while you're answering that, is when is it right? Because morals now come in. Parents do not want their teenagers to be told they can't use condom. That there's even an option, especially in Africa where we are so spiritual, so to speak. There's no option of condom, just abstain. But unfortunately, it's getting out of our hands. So where do you draw the line in advocacy and awareness in all of this?
Yeah, we know that young people explore.
Exactly.
That is it. And in the process of exploring, they engage themselves in other exploitative acts. Within the condom demand creation strategy, we have condom use for a particular set of people. But let me let you understand that what you say is not unconfirmed report.
Right.
This is a confirmed report that the mode of transmission study we had in the country has confirmed that we have high prevalence, high incidence among never married young people. When you're never married, it means that you are at home with your parents, or never married young people. The mode of transmission report study of last year, 2021, 2022, has said that. And we have issues with condom use among young people because of policies.
Okay.
We have national policies that say you don't talk about condom in school, in secondary. We do awareness in tertiary and do drop box. If most of our sexual institutions, University of Abuja, Uniport, in those days when we were having condom drop boxes, though the young people were, misusing the opportunity.
Exactly.
You have drop box, you go, you press it, condom will come out, you take. We are in tertiary, but in secondary, because the national policy says that age of consent is still below 14.
18.
It's still below it's 14.
Okay.
You understand? So if your young child needs at 14 years, need to talk to you before he uptakes services, means that you cannot give him condom because he has to get the consent of the mother or father before he can take the condom. So we are also advocating. We have gone to the National Council. Council memos have come up that we need to reduce age of consent to 14. So from 14, 15, we have seen situations where young people have started having sex at that area. We have 12 years old baby giving birth to a child.
Wow.
And all that. These are things you are seeing in this country. So if that child has knowledge of condom and the way to use, even if it's not her wish to use that condom at that time, at that moment he can say, please,
Well, my mom used to be the public health coordinator of a local government, and she had, you know, the WHO and NACA and USAID. They had this support for condoms, and her strategy. She has 5 girls. Her strategy was, I have a pack of condom, like a carton of condom in the house. I did not count it. Feel free to use it. I'm not going to question who used what. Would you say that's a good strategy for parents to adopt?
Because that parent is informed.
Is informed, yes. But let me ask, please. Religious institutions have been our yardstick for morality in Nigeria. What has the message been like, or the partnership with religious institutions? We know we have a lot of youths in various, you know, churches or mosques that gather, and we know that most religions frown on fornication, premarital sexual intercourse. So what's the synergy between religious institutions and the message of spreading love and not the virus?
Actually, we have a very big support from the religious institutions.
Okay, great.
Yeah. We have the Christian segment and the Muslim segments. They are all supporting the national response. Okay. We have a Nigerian network of religious leaders on HIV, Nanarela, that works with us. We have the Sultan of Sokoto. We have the Cardinal, who are the Cardinal of Abuja, then an icon, who are co-chairs of this inter-religious organization on HIV. So, and we have religious leaders who are also supporting advocacy efforts, who are also openly living with HIV, who are positive, and they come out to say, I'm a religious leader, I'm living with HIV. So that's what I'm saying, that we have given a face to HIV.
A human face.
Human face to it. Unlike those days when we draw a skull and put 2 bones, someone is on the run. Yes. But now, when you now see that, the person I'm talking with, this is my pastor, this is my manager, it's okay. And you can see that once viral load is suppressed,
you can't transmit.
And you see people living fine, healthy. So far, you are adhering to your treatment. Adherence is very important to treatment. And let us understand that you don't need now to go to a lab to do your test.
I was going to ask about that, the self-test, right?
Self-testing.
So tell us a little bit about that.
You can uptake self-testing by getting the self-test kit, and on your own know your result. And we encourage that when you know your result at first testing, you also confirm from a health facility.
How often should people do their HIV tests?
From studies, no viral progression, I would say at least the window period of 12 weeks. Okay. That's it. So if you can be doing that every 3 months to check your status. And not only 3 months, it depends on your risk exposure.
When you say risk exposure, how
often? If I'm involved in unprotected sex, it's as good as I am getting exposed, I should be checking my status.
Okay. Right.
And that is why we have PrEP, pre-exposure prophylaxis. And today, like we say, it's Valentine. The message is that if you don't have your condom, for those who will have sex today, please uptake PrEP today.
What's PrEP?
PrEP is the tablet you take. It's just like it's an ARV. Almost the same tablet used for treatment. If you take it within the space of hours before you get exposed, you will not get infected.
Oh, that works.
Yes, and
I never knew that. So I see you learned something too. I personally am enlightened because I never even knew there were tablets like that you can take before that. Oh, that's
good. Within the key population, when we talk about key population, we're looking at men who have sex with men, female sex workers, those who inject drugs, transgender people, and those who are in custodial settings. We advise them because they may be event driven. Okay. Like a sex worker who goes out today may just go out, let me go and have Valentine. And the process may have unprotected sex. It's event driven. So if you're on PrEP, you're protected. After sex, and you get to know that you're at risk, you can go back to take PEP, which is post-exposure.
So how do they get this pre-exposure prophylaxis?
Yeah, pre-exposure prophylaxis and post-exposure prophylaxis, you can get them from our service providers. Or you call our toll-free number 6222.
6222. Okay, I think the director should just quickly put that on.
If you call 6222, it's a toll-free number. We'll have people there who will give you all information you need to get about HIV services in Nigeria. They will tell you service provision, locations in Abuja and your environment.
Sadly, we have to end the program. The director is saying round up, so we've really run out of time. But we'll invite you again to talk extensively, because I personally just learned something new today, and I didn't know about that. So we want to thank you, Mr. Kingsley Esemono, for being our guest this morning.
And we're ready to come back again.
Please, we will hold you to that.
We are fighting HIV to finish.
Yes, and we are all in this race together. We're all in this race together.
Unfortunately, we've run out of time this morning, but of course we're going to be here tomorrow, same time, 8 o'clock to 10 o'clock. So do join us. My name is Ifunanya Amafili.
And I am Joy Asonye. Go ascertain where your polling unit is so you can vote. Have a wonderful day.
Goodbye.